Dr. Yoni Whitten is an expert on movement and specializes in the permanent resolution of chronic pain. He's a lifelong athlete and has seen firsthand how the body's capacity for physical and mental adaptation influences performance at every level. Dr. Whitten attended San Diego State University, where his passion for pushing the limits of human performance led him to pursue a Bachelor's of Science in Kinesiology with specializations in both nutrition and health. He went on to receive his doctorate of chiropractic from Cleveland Chiropractic College, where he graduated at the top of his class. In addition to working with patients day in, day out for the last 15 years, he has worked tirelessly to advance his education. He spent many years researching and studying with experts in manual medicine and rehabilitation from the Czech Republic. I think that's interesting. And with brilliant clinicians in the field of functional neurology here in the US. He was also one of the first doctors in the US to be awarded the prestigious status of Certified Wellness Practitioner by the ICA Council on Wellness Science. With his diverse background, Dr. Whitten has developed a unique approach to the resolution of chronic pain. His program, the Pain Fix Protocol, blends the latest scientific research with essential concepts from the field of natural movement, evolutionary health, nutrition, spinal hygiene, self-care, and human performance. The Pain Fix Protocol goes beyond just treating pain and instead effectively treats the whole person. I had a question for you. Do you know Sean Croxton?
I know Sean.
Did you guys went to the same school, right? Or did he go to a different school?
I think Sean went to the other school that's in Los Angeles.
Oh, okay.
But he went to school a while before I did.
Oh, he did. Okay.
Yeah, I know Sean. He's a friend of mine.
Okay, yeah, it sounds like a little bit in your background. It's a little similar, and he's out in San Diego.
Yep.
Awesome. Cool. So before we got on air, you said you kind of like to debunk the idea of chronic pain. So let's start with a little bit of a stimulating question. Why people need to experience pain?
Why do they need to experience pain?
Yeah. This is a talking point your team sent me. Why people need pain? Was that the wrong one?
Oh, this is a great question.
Okay.
Yeah, so that's a funny way to start off, actually. Pain is a warning signal from your body. It's a signal to bring your attention to something like a flashing neon sign in the night that, hey, there's something wrong here. If you're walking and you stepped on a giant splinter and it's lodged in your foot, and every time you take a step, it presses in a little harder and your body goes, alarm, alarm, alarm. I need you to get this thing out of your foot so that you stop creating more damage with every step. So that's the basic idea of what pain is. Now, it really gets a bad name because it's an inconvenience. Life is so busy nowadays, and we're all so hustling and connected to people every minute of the day on Facebook, like we are right now, or Instagram or what have you, that we don't want to be bothered with the pain. We'd rather just be like, leave the splinter in my foot and I'll deal with it another time because I got some likes to check up on Facebook or whatever.
Yeah, it's true.
I can assure you that if our bodies had not adapted the capacity for pain, we would not be here today. It's a critically important warning signal. And there are conditions where people are born without the ability to feel pain. And it's actually extremely dangerous and debilitating. You can have somebody who has no capacity to feel pain and they have their hand on a hot stove and they don't know it.
Wow. Okay.
No pain is not a good thing.
Okay. Yeah, well, let's move into chronic pain. I think people could understand, okay, you broke your ankle, your body doesn't want you to step on it, so that's a message. People kind of accept that a little easier. But you're right, like with chronic pain, it's especially inconvenient because, for me, I've been seeing a great massage therapist. She's like, no, are you doing your roller? Are you doing this? Kind of, it's hard to say, I want to do X, Y, and Z, but I really need to spend 20 minutes rolling and stretching. It's just one of those things. It's funny because brushing our teeth, we all are like, yeah, we got to do that. But stretching or doing different body care, do you feel like it's not as much of a cultural priority?
Well, you bring up a few really interesting points there, Bridget. So let me go back a little bit. The the premise that's overarching from everything you just said is that the lifestyle that we're living nowadays is normal. And so having to spend the 20 minutes or like you said, or whatever, foam rolling or stretching becomes then necessary. Like the example that you used, brushing your teeth, eating is necessary. So we need to clean out our teeth and floss out our gums to make sure that we preserve them for a lifetime. The problem is with that overarching assumption is that from the standpoint of the evolution of our species, the lifestyle that we're living nowadays is completely unnatural and wildly inappropriate for our physiological needs. So if we take and compare ourselves to hunter-gatherers, like they were walking 5 to 9 miles a day, every day.
And doing functional movements to survive.
I mean, they didn't know they were doing functional movements. They were walking to find food and to build shelter and to make clothes and to carry water and to do everything that's involved with childcare and making tools. And they weren't focused on stretching and functional movement. They were just functioning.
Right. Okay. So I think you were saying is like when we're in front of the computer, when we're sedentary, then suddenly, okay, why is my back hurt all the time? I have to do my stupid rolling. I don't want to, but it's all like goes together. It
all goes together. But you also brought up this really interesting point, like, oh, this nagging splinter, like, I don't want to do the 20 minutes of, stretching or foam rolling or whatever it is. So I got a message from somebody who had been introduced to my work and she sent it to me, and I'd love to share it with you because it cracks me up. And not in a bad way, in a way that's like, yes, this is why I created my program. So she sent me, I am a very active 52-year-old woman with no reason for suffering neck pain like I have for the last 20 years. Okay. She did a brief consultation with me via Zoom. And within the first 5 minutes, we found that she sits most of the day. She had a significant forward head posture where her head was inches out in front of where it's supposed to be. By the way, for every inch that your head moves forward, it adds 10 pounds of functional stress that the muscles need to support. And they're supporting it all hours of the day that you're not lying down. So that's reason number one. Reason number two, she had a positive trap sign, which the Journal of Neurology said this is evidence, very strong evidence, that there's been a reversal of the normal curvature in the neck. So a trap sign means that these muscles here at the base of the neck, the trapezius, are jacked up like a bodybuilder's, but it's in a person who doesn't lift weights.
So is that to compensate for the forward head?
Yes. The muscles get big and huge and full of blood because they're having to carry so much extra weight from the head being in a forward head position.
Oh.
So then she's been having this problem for 20 years. Those muscles have gotten really big because it's like she's doing like working out of her muscles here every single day for 20 years.
Okay.
And then reason number three that came out, she had 40% loss of the normal range of motion in her neck.
Wow.
So normal, say the ability to rotate your neck, you should be 85 to 90 degrees. So you should be able to roughly turn the point of your nose in line with your shoulder from both sides. Okay. So my physical exam in the office is very long and very involved, but with a few minutes of speaking to this woman who felt like there was no reason for her to have the pain that she'd had for 20 years. It's a false assumption that's not based on reality. It's the body was designed to do certain things. And if you do those things, you get a predictable result. If you don't do those things and you fail to do them consistently over time, the result is also predictable. And so that gets back to your first question, which is, what is pain? Pain is a warning signal that you're going in the wrong direction.
Yeah. Okay. It's a great point. And that woman probably was like, well, I walk or I work out and I eat right. There's no reason, right?
That's right. That's right. But there was a group of researchers a few years ago that followed people around who work office jobs, and they found that 80% of their day, they literally attached EMGs to their muscles and saw what their muscle activity was all day at the office. And they found that 80% of the time they're sitting down.
Mm-hmm.
80% of the time they're sitting down, and the more you round your back when you're sitting, the less muscular activation you get. Basically, you're relying on the external support of the chair, and so your muscles are just deteriorating.
Oh, wow.
So we talk about muscle deterioration with age, but the bigger factor in modern society is not aging, because in modern society, people live a long time, but our muscles are deteriorating rapidly. We even have children now that have deteriorated structure and muscles because we're way more sedentary as a society than we were 2 generations ago, and certainly 4 or 5 generations ago.
Yeah, it's tough because I think probably like that woman, we think, well, like for me, I walk my dogs, I go to the gym, I do sports, but I also work on a computer most of the day. And some, like right now I'm standing, but I definitely don't stand all day because I don't want to. I'm tired. I want to, it's just like, it's just something, always feel like motivated.
For sure.
Yeah. For sure. And if you don't mind me sharing some of my story, I used to have a lot more chronic pain when I was living in a moldy environment.
Yeah.
And it went down a lot as my health improved. So I sort of was like, okay, well now it's only a 2 or 3 out of 10. So I'll just I'm good now. Until I got a concussion in last October, and I was not recovering at all. Yeah. And I had zero awareness for about a month. It's because my neck was so tight that like nothing was draining out of my head. I had no awareness. And as soon as I started getting treatment, it cleared up very quickly. So it was like a wake-up call for me, like, girl, you're not taking care of your body. Like, you're way more tight than you need to be. So I've been more active in the process and, learning. And I think it's just I guess I want to say it's a very worthwhile thing to invest in. Because if you kind of ignore that part of your health and you think, oh, I'm taking walks and I'm eating right, that's it doesn't seem to be enough nowadays.
Well, yeah, you bring up a really good point. So you said you were experiencing way more pain when you were in a moldy environment. And the thing to remember when you're working with chronic pain is a sensation. It's totally subjective. Each person's pain sensitivity is different. We all come into it with a different threshold. So it takes different amounts of what's called nociception, which is noxious stimulus from the nervous system, to fill up our bucket to the point where it crosses the threshold, and then we register conscious pain. Now, the pipes that can fill up that bucket are far and wide, and I'm not saying that structural health or posture is the only thing that fills up that bucket. You just brought up mold. You can have isolation, which has been a big thing with COVID. We've had tons of people suffering from social isolation, and we're a social species. So when you put us into solitary confinement, we suffer. Our stress levels go.
Okay, so you're actually saying like we can experience more pain under that stressor?
100%.
Wow.
100%. And that's really important to understand, is that pain is a warning signal that something is wrong. We have studies that show that one night of poor quality sleep elevates a person's pain levels significantly.
Okay.
So you could have status quo in the body, and you have one night of bad sleep, and your pain rating could go up as much as 30%. So it's stressors of all kinds. And what it does is it alters the threshold for when pain spills over and becomes consciously recognized by the brain, because most quote unquote pain is being dealt with at the subconscious level. And it's only for those people that are consciously aware of it that they're hitting their threshold consistently day after day, and they're never dropping below it. And frankly, it's a miserable way to live, and it ruins a person's life.
Yeah, it's very consuming when it's at a certain level.
For sure.
Yesterday, when I was not aware I had mold, I was going to all sorts of appointments and not really getting to the bottom of it, and it was really disheartening.
That's right. Yeah, and the patients that I work with feel exactly the same way. They've tried and they've tried and they've tried, and you brought up another interesting point there, which is people are always looking for what's the one thing. And with chronic pain, it's, geez, I don't want to say never, but almost never one thing. There's always multiple factors that are contributing. So you could do the best structural work in the world, you could do the best acupuncturist in the world, but if that person is sleeping on a foundation of mold and breathing it all night, 8 hours every night, like you just said, that person's never going to get better. You have to. So most of what I've done in clinical practice, and it's funny, you know, I had the realization several years ago, most of what I do now is not the physical work. Most of what I do is detective work to figure out what's going on in that person's life.
Is it people that are coming to you having already done a lot of the functional work? Gotcha.
Yeah. So the average patient that walks into my clinic has seen 6, 7, 8 other practitioners before they get to me. And very often they're on the verge of getting surgery. So like I've been cursed and blessed with this high pressure situation with a lot of the patients that I work with, where they're like, look, this is my last stop. It's either this or surgery. So it's like, kind of white knuckling it in my first few years of practice. And now it's become a lot more fun.
Oh yeah. That used to be a pressure on me too when I moved online. And then I realized, you know, over time, there's always something more we can contribute, especially when we're, you know, learning. And, you know, if I'm ever feeling stumped on a case, I'm going to be researching for that client. And so maybe one little thing you tell them is something that they haven't heard before. So we mentioned, I just want to go through all the kind of possible things. So it's sitting, forward posture, mold, isolation. What are some other causes here, contributors?
Poor sleep, dietary factors, emotional stress, psychological stress, all of those things. Look, there's studies that show that that people who go out and engage in altruistic behavior experience less pain.
That's cool.
So the people who are very focused inward, which pain has a way of doing to you, you know, the more pain you're in, the more you're just like, oh, just focusing more and more inward. And I always call it, you know, people who are in really serious chronic pain, their world shrinks in. They stop being concerned about other people. You know, it's like that situation where you're on the plane and you lose cabin pressure and you're so worried about yourself, you just don't care about what's going on with anybody else. And if you're going to be an asset in a situation like that, you take care of yourself first, but then immediately your focus shifts to others. With chronic pain, you don't make that shift, but they've found that if people force themselves to go into altruistic behavior while they're in chronic pain, while doing nothing else, their pain levels go down. So it's a really fascinating thing. And my expertise is on the structural and functional end of things. I've never found in my practice a person who comes in with chronic pain that had normal functionality. And I mean normal by, these are the accepted orthopedic standards across the board in the textbook. Can you turn your head the proper amount to both sides? Can you tilt your head the proper amount to both sides? Can you breathe and hold your neck in a supported position without failing? These are very basic tests. Any 5-year-old passes my physical exam with flying colors. And yet I have patients that range from their 20s to their late 90s, and not a single one of my chronic pain patients can pass the functional exam.
Wow.
So deterioration of function and deterioration of structure go hand in hand. That's what I was saying about that woman who contacted me, and she said, I have no reason to be in pain. Well, her structure was altered and she'd lost the vast majority of motion in her neck as a result of the altered structure. It's like, it gets confusing when people look at the physical body, but if I talk about it in terms of a car, everybody understands. Nobody who drives a car would be surprised that their steering wheel is shaking and their tires are wearing out in strange ways, and they're not getting good mileage if their wheel is tilted like this and they're driving on it. Right? The alignment is so far off that I can see it with my bare eyes, and the tire is wearing out asymmetrically and the wheel's shaking because of that. Same thing with the body. If you push the head way out in front of where it's supposed to be, the muscles have to work a lot harder, as if I was holding a weight here versus holding a weight here.
Yeah.
It's totally different. It's way heavier, and my muscle has to work a lot harder to hold the weight when it's further away from the body. Same thing with the head. The muscles have to work a lot harder, but the joints in the spine, the individual spinal joints, are not lined up or centrated the way that they're supposed to. And so the joint doesn't function the way that it's supposed to. So of course she can't turn her head the proper amount. She has no chance. The joints aren't lined up.
Okay.
So we're not talking about a subluxation, to use a chiropractic term, in the traditional sense where the joint is stuck. We're talking about a situation where her body aligned, she has a global subluxation where her entire posture is out of alignment. The only way to fix that is to put the normal curvature back in her neck and stack her body as it was designed. The way that posture is designed is critically important for the only species that walks around on two legs. We have to operate efficiently, otherwise we don't survive, actually, because it's a matter of being efficient with the energy that we bring in. You've heard that. So most animals in the wild, they spend most of their day searching for food in order to survive, to provide themselves with enough energy to survive. Human beings, we live in a time where not a lot of people in the country that we live in are having any problems with not getting enough calories.
Right.
So that's not really an issue, but as our species was evolving, being able to make the calories that we did get last as long as possible was very important. So we have all these really intelligent adaptations, like the curves in our spine that put us into a very balanced position that requires a minimum of muscular effort to keep us upright.
Okay.
So the curves of the spine are such that it lines the center of the head up with the center of the shoulder, with the center of the hip directly over the foot and ankle. And so very little muscular activity is required to keep it there. It's like if you were to hold a baseball bat upright on your palm, you're doing very little to keep it perfectly balanced. You know what I mean?
Okay. So let's go back to this lady who reached out to you and you found her neck issues and stuff. What advice did you give her to help get her stacked up better?
So the program has all the specifics for that.
Okay.
There's a lot of different factors that go into it. There's lifestyle factors, which we've been addressing so far, what we've talked about. If you're sitting all day long, how are you sitting? Are you willing to switch to a standing desk for part of the day like you did? It's great. It's a great solution. So what we're doing is we're dealing with each one of them as a strategy, and then we're adding in what's called progression. So like a person who's training for a marathon that's 26 miles and they've never run a day in their life, you're not going to take them out and run them 26 miles. You might start off with, okay, we're going to run once around the block, or we're going to run a quarter mile, and then we're going to slowly build up from there. Same thing you do with a standing desk. Maybe I'll have you start out with your standing desk and you stand for 5 minutes out of every hour. And you start getting your body acclimated to standing. And then you slowly build up over time, working up to that marathon distance.
Okay.
Right. And we would do the same thing in terms of her physical functionality. We would work on molding the ligaments that cross the spine. We would work on introducing more motion into the joints of her spine that are restricted. And these are all things she does for herself. And then we would work on building strength in the muscles that support the body in a normal posture so that she could maintain it for a lifetime. And we would add progressions to each of those over time that would allow her to start off at a level that allows her to be successful and build up some results and build up her confidence as we add more and kind of gain momentum.
Great. I love it. Okay. Well, I don't know if we answered this question or not, but the most common underlying issues for chronic pain, did we cover all that, or anything else we sort of missed?
It's hard to say most common, and I'll tell you why, because I'm biased. So I deal with the structural and functional side of things. And I would go back to what I said a minute ago, which is I've never had a person come into my practice with chronic pain who has passed a basic functional examination. So how I would answer that question, admittedly I'm biased, is alterations in structure and alterations in function.
Okay.
Because I have not seen a person with normal structure and normal functionality have chronic pain. I haven't seen it. I've been in practice 15 years.
Okay. Yeah, that's a really interesting little battery of tests. I'm sure that you put people through?
It's actually super simple. It's all easy stuff. Like I said, any 5-year-old my daughter passes my test in an instant. Like none of it is hard.
Right.
It's all things that these people, even the people that I see in my office with chronic pain, probably all of them could have done those things at one point in their life. They just lost the ability.
Right.
Because we adapt to whatever we do. So if you're adapting to sitting in a chair all day long, if you're adapting to lying on the couch and watching your favorite shows and you're not moving at all, your body adapts to that too.
Yeah. Yeah. I always like to kind of notice, like yesterday we hiked down to a river to go to the swimming hole, and it was pretty unsteady or whatever, uneven, and you know, you're carrying stuff, and I'm like, this is the kind of thing I want to just be able to keep doing, right? Yeah. Like the ability to do these kind of irregular movements and adjust and balance. To me, that's like a sign of health, my athletic kind of physical health. So
yeah, and I agree with you. There's a, you know, getting back to what we were talking about in the beginning, a lot of people don't want to foam roll and don't want to stretch. But what if you just incorporate it into your life? Like you're saying, go for a challenging hike. I like to surf. It's play and physical exercise for me.
Oh, that's a great point. Yeah.
I like to rock climb. That's also play and physical exercise for me. It's if you can combine it with something that brings you pleasure. You know, I never advocate for somebody to go lift weights or start a running program if they hate to do it. Find something you like to do where you move your body. That's the best thing.
Yeah, okay, I like that. Yeah, I was telling my friend I went to the gym the other day and just did like really low weights on everything. It was hot out, and I'm like, I almost just feel like I'm kind of stretching because I'm not as tense, but I'm getting a little weightlifting and
that's right. That's right. It's the best form of exercise. This is not my quote, so I can't take credit for it. The best form of exercise is whatever kind of exercise you enjoy, because that's the kind you'll do.
Yeah.
And it's all about consistency over time. So like we were comparing notes on kids when we started, right? And so one of the things that my wife and I have, you know, we kind of have our back and forth negotiations on stuff with our 2.5-year-old. And, you know, I don't like giving her screen time. I like to take her out and run her in the canyon or run at the beach or play in the water or whatever. But my wife likes to give her a little screen time so nobody loses their mind, and that's important. And so what we arrived at was she gets a certain small amount of screen time every day, and we put a rebounder right in front of where she watches so that she's jumping and rebounding while she's doing that.
Oh, that's a really fun idea.
So we have stuff like that, or we have a whole body vibration platform that will incorporate, you know, while I listen to a podcast or whatever. And you can't see it here, but I'm actually sitting in a kneeling chair, so my muscles are heavily engaged even while we're sitting here chatting.
Nice. So let's see.
And that's really what I hope to do with the program, actually, is just give people lots of options, and then they can figure out what works best for them.
Cool. I like it. I think I should attend the webinar. This is something I'm kind of focusing on. Robin, I put the link in the chat, and I'll share the screen here. I like to share it so people can kind of see. And then we had a question from Pamela. If anyone else wants to ask a question, now is a great time. So this is what the page looks like. So it looks like it's 12 Eastern, so it'll be 9 Pacific. I think you do a Q&A usually afterwards too, a couple of days after or something.
Yeah, I'll answer questions live, and that usually goes on for, wow, we get a lot of questions. People enjoy the Q&A, and then we do a follow-up Q&A because usually we don't have enough time to get to all the questions.
Okay, perfect. Yeah, again, I just want to advocate, you know, we mostly talk about detox and nutrition, and but I, in my personal life, am a big fan of physical movement. It's just not as much of my specialty to teach about. So I like to bring in people like you. We've got Deborah Atkinson and Emily Kyberd both coming back on the show recently. I don't know if you know them, but Deborah focuses on exercise after 50 and kind of, you know, finding it's a little different routine sometimes as we age. And Emily talks about exercising with thyroid disease, so it's just cool, and it just gives us, you know, some different solutions and ideas for
100%. And you bring up a really good point there, which is it's not one size fits all.
True.
You know, it's got to be appropriate recommendations for that person's situation. And so a lot of times with chronic pain, I have patients with chronic fatigue, a lot of people who haven't exercised in a very long time because it hurts when they do certain things. And so, like I was saying earlier, the most important thing is to show them that they have the ability to alter the amount of pain that they experience by making certain modifications, whether that's lifestyle modifications or adding some detox protocols or adding some very specific movement routines or some fascial stretching like we talked about earlier. Any little thing that we can do. And I use a rock climbing analogy because it's something that I like, but when you're starting out a very difficult climb or taking a very difficult test, if the first question wipes you out on a test, it usually tanks a person's confidence and they're like ruined mentally going into that. So what I like to do is I like to start everything off in the program as simple as possible. And we always have the caveat, this needs to be pain-free while you're doing it. So I teach them how to modify the movements to fit wherever they're at, and then they can work it up over time. But you have to be able to knock that first question out of the park. If you're rock climbing, you have to get that first hold on the wall so that you can actually move on to the second one. But you can't even fathom getting to the top of this thing if you can't secure yourself on the wall from the starting position. And that's what I want my program to do, is guide people in a way that makes it very easy for them to stick with it long enough to get the result that they're after, and basically to shift the course that their body's on.
Okay. Is it a bit of like a gamification or just step by step? Like, how do you structure it?
Yeah, it's a choose your own adventure, actually.
Okay.
So there's a foundation masterclass that I like everybody to go through because it helps them to understand what pain is, like what we started off with in this talk. Understanding what it is, why it's there, understanding that you don't need to be afraid of it. You need to really have a conversation with it and find out what's going on there. Because, we're so fixated mentally here in Western society with covering up pain. It's a very weird idea. The pain is inconvenient. I don't want to deal with it. I have a headache. I'm going to take ibuprofen, or I'm going to take Aleve, without even asking, why do I have a headache?
Right.
The pain is there for a reason. So, but if somebody goes into to see a urgent care with a very severe form of chronic pain, most likely they're coming away without a diagnosis. So we'll take low back pain. It's the most common form of pain in the world. You're talking somewhere in the neighborhood of 500 million people worldwide that are suffering with low back pain. Now, here in the West, when people go in to see a conventional medical doctor, 85% of the time, they are going to be not finding a physiological cause for their problem. And one source quoted that 98% of the people, 98% of the people that go in with chronic back pain to the conventional medical system come away with a diagnosis of non-specific low back pain. And they come away from that with that diagnosis, which is essentially it's no diagnosis, because that doesn't mean anything. And they come away with a prescription for anti-inflammatories, another for painkillers, and a recommendation to rest or immobilize the painful area. I call it the clinical dismissal. Mm-hmm. So it's like, take these things and get out of here. But if we switched over to a dental model, that would never be acceptable. People come away from that model when they see a conventional medical doctor for back pain, and they come away with painkillers and they feel like that's what should happen. I got these really powerful painkillers to get rid of my back pain, and they couldn't find any physiological cause. But these people come into my office and they can't pass a basic functional examination. So if you took that same person and they had tooth pain and they went in to see a dentist, and the dentist said, oh, you have non-specific tooth pain, here's some drugs to cover up your pain, nobody would accept that. Right? So with a dental model, they're saying, what's causing this? Do I have an abscess? Do I have a cavity? Do I have a loose crown? in other words, we have an understanding within dentistry, and we have to credit the dental profession with this, that they have done a phenomenal job educating patients that when you have pain in your mouth, it means something. Now, conventional medicine has done the opposite. They've done a massive disservice where 85 to 98% of people who go into their system with back pain are coming away saying, oh, it's non-specific, there's no physiological cause, which basically means they did an x-ray and they didn't see anything on x-ray.
Yeah.
Okay, but I don't have an x-ray machine in my office. If a patient needs x-rays, I send them out, but that's not part of my basic examination unless a person has been through trauma. So they're not looking at the structure and the functionality. They're coming away with this nonsensical diagnosis of non-specific back pain. In other words, you have pain, but there's no reason for you to have pain. Exactly what that woman said to me in our communication.
Yeah.
There is a reason.
I told her that. It's a great point. Yeah.
There is a reason. It just didn't show up on x-ray. And it takes a little longer to find out, but not much. If you know what you're looking for, it's not hard to find.
Yeah.
And again, I'm not saying that's the root cause of everybody's pain. But what I am saying is, with all the chronic pain patients that I see, not one of them can pass a basic functional examination. And it is a way in. It's a way to answer that first question on the test and knock it out of the park. Because if you improve your structure and if you improve your function, you will have less pain. And so it's one of those pipes that's going in, that's elevating nociceptive input into your body and helping you to reach that threshold where it's spilling over to conscious pain. And if you cut that out, you're going to drop below threshold and your pain levels will be less. That's what I'm saying.
Nice.
So it's more of a holistic approach. You're looking to reduce what would be called the total stress load or allopathic load on the person, which is the cumulative stress that they're under at any given moment from all causes.
Okay. Well, that's a good question to piggyback on. Pamela said, do you find that Lyme, Bartonella, Babesia, etc., need to be addressed to relieve pain in the joints, feet, neck, and other parts of the body?
Yeah, I mean, it's a beautiful question, and it piggybacks right off of what we were just talking about. You're talking about reducing cumulative stress. I've worked with a lot of patients that have Lyme disease, and I am not the only practitioner that they're seeing. They are also working with acupuncturists. They're also working with detox specialists. They're also working with functional medicine practitioners. The idea is, the body is compromised in that disease state, and we want to alleviate as much of the cumulative stress as possible so that the body can direct its healing energy to recover from what they're dealing with.
Yeah. So I like the team approach. I think we talked about that an episode or two ago too. And like I said, Pamela, I think I got a little tunnel vision, like, oh, my mold's better, my pain's less. Now I can kind of cruise, but I was sort of ignoring, okay, I'm slouching, my head's forward, stuff like that. So it is like looking at all of it, not just the one thing.
And I want to switch the model, actually. My goal when I'm working with a person is because pain-free is very subjective. Like I said, it can change with one night of bad sleep.
True, yeah.
So what I want to change it to is more of a dental model, which is, even if your teeth aren't hurting, you should still be brushing and flossing.
Right.
You know what I mean?
Prevention, yeah.
That's it. So that's the key. You start out behind the 8 ball and you kind of have to dig yourself out of this hole that you're in, that the symptoms are, the pain is making you aware of. And then once you dig yourself out of that hole, then you get to the prevention side. And that's where the fun really happens, where you're actually working towards the expression of human health, which is an amazing thing. And when you see people who have been struggling with these problems for so long get to the point where they're expressing health and they're not thinking about symptoms at all, that's really fun. So rather than thinking about, am I having pain today? Then I'll do my exercises. You say, I'm going to brush and floss my teeth so that I can keep my teeth for a lifetime. I don't care whether they're hurting or not. So I'm going to do these basic movements every single day because my body is designed to do those things. And I want to preserve my joints for a lifetime. I'm going to go for a walk a few times a day, a short walk to move my joints because that's what my joints are designed to do. And my brain works better and my heart works better and my lungs work better and everything works better when I do the things that my body is designed to do. And the converse of that is also true, that everything works worse and feels worse when you fail to do those things.
Yeah, it always makes me really sad when I see people like at the grocery store and, somebody needs to drop them off at the door because they don't want to walk from the parking lot, or, they're just kind of shuffling behind the cart. And it just kind of breaks my heart because it's just like your movement has become so limited.
Yes.
And I don't think that's anywhere where any of us want to end up. And that takes all the little decisions from now till, these are usually older people. And I want to be the person pushing my cart with some pep in my step and, just still going, which I think is consistent. You hear about cultures, different cultures where there's more walking and, not as many cars, and they still have that because they just are doing the thing. So
yes. Yeah. You bring up a really interesting point, which is how do you define normal? So I define normal as the ability to pass a basic physical examination. It's normal. It's normal. I'm not asking a lot of these people. Can you get down and up from the floor? That's it.
Yeah.
Can you get down and up off the floor using a minimum of assistance from your hands? That's a little bit more challenging, but any kid can do it. Can you turn your head over your shoulder? Can you look behind you when you change lanes or when you back out of your driveway? This is all practical stuff. There's nothing, my examination is not designed to enhance performance in super athletes. It's designed for a person to be able to negotiate and enjoy their life and be able to do things and not feel restricted. That's what my program is for.
Okay, I think we had a couple more questions. Margie just asked if she can't attend the webinar live, will she get a replay?
Absolutely. Sign up. We send out a replay as soon as it's done.
Okay. And okay, the other thing is just a thank you. Any other questions, you guys, before we wrap up here? Yeah, I think this has been really interesting. And again, I just, really value movement. I think still, like, we're learning so much about functional medicine. It's fantastic. I think we're learning a lot about movement too, and it's really exciting stuff. So I think some of what you're doing is very progressive. I just was at the chiropractor the other day. It's kind of a little quickie, drop in place. And I said, well, I'm still kind of stiff, even though I'm trying to do these things, I always get stiff again. And he was a little bit like, it's kind of normal. Like, and I was like, I don't really want to hear that. I want solutions. And he's given me some of, he's definitely given me some ideas. But I think what's normal is a lot of people will just go in there and get cracked and not really make changes in their habits. So he's kind of speaking to that normal. And I'm like, I don't really want that normal.
Well, I love what you said there. I feel that that's a very healthy attitude to have, which is I don't accept that. I don't accept that stiffness is normal. I accept that stiffness is a symptom and it's there to tell you that something is off from normal and some kind of a modification needs to be made.
Yeah. Okay, well, I'll come to the webinar and check out the program a little bit more because, I'm definitely like on the hunt right now for, solutions and just some things. Like one thing I've noticed, I spent years getting a headache at the end of the day when I stopped working.
Yeah.
I didn't really know it. And then I was just like, it's because you're holding your breath and like holding tension the whole damn day. Yeah. So by the time the day's over, I'm like, my head's trying to drain and my lymph is stagnant. So even just for me, like if I can take 10, 15 minutes in the middle of the day to just calm down, be relaxed again, that's just such a simple thing to do. And maybe the next person doesn't need to do that. But for me, that's my tendency.
Yeah. And you bring up another really interesting point there, which is breath work. Now, check this out. this is going to bring that idea of everything being interconnected home, because when a person gets into severe forward head position, they actually slack the muscles here in the deep neck that are responsible for elevating the top ribs. If you can't elevate the upper ribs, you can't fully inflate your lungs. So what they found is that people with severe forward head position can lose as much as 30% of their lung capacity.
Yeah, I believe it. Yeah,
So,
I'm definitely
so
having
all of these things are interwoven. You're talking about, oh, I can't breathe as well at the end of the day. Well, if you've been on a computer all day long and your head is sinking forward, there's multiple factors at work there.
Yeah, yeah. Well, thank you so much. This has been super fascinating. Yeah, I reposted the link in the webinar to the webinar. People asked if you're on Facebook, it's in kind of a little paragraph that came along with when I posted the interview. We always put these up on YouTube in a day or two, so you can always go back to it. Next week, we are actually talking to Deborah Atkinson, who's my friend who does fitness over 50. So
Awesome.
it'll be just a little different take on, all of some things we learned today. And actually today, in 7 minutes, I will be doing an Instagram live on breast implant illness. I'm super excited to be learning more about that topic. It's really emerging as luckily we are having some realization that those things are as healthy as we thought. So for the people who are dealing with that, giving some solutions and that kind of a thing. So that will be on Instagram in a few minutes here.
Nice.
Yeah, any last comments, Dr. Whitten, or anybody else?
I just want to thank you so much for having me on, and I appreciate it. And
Yeah.
I look forward to you joining in for the webinar. We're going to be touching on a lot of how movement influences brain function and how that directly translates to pain levels in the body. And if that is something you're interested in, we're going to go through all the science of it Saturday the 26th.
Okay, perfect. I'm going to sign up now, and yeah, maybe we'll see some other folks from today on there. And yeah, thanks for your time and just your research. You're clearly passionate about it, and we just need that. We need people to passionately study and share. So we appreciate your time.
Thank you so much, Bridget.
Thank you. We'll see you next week.
Okay. Bye.